Hey everybody, and welcome to Autism Awakening, the podcast that helps you help your child with autism. My name's Dr. Jared Skowron, and it is the beginning of 2024. I can't even believe I'm saying that number, that's the year right now. But I'm excited to start a whole new line of podcasts that are kind of in order. You know, when we look at our kids on the spectrum, when we say, hey, geez, our kids aren't speaking anymore, or geez, they're not making eye contact with me anymore, or they're not doing this, they're not doing that. There's a lot of questions that come up for you guys of what's happening to my child and how can I help them? And me on the other side of the coin, I've been a biomedical MAPS doctor helping kids with autism for 20 years. And I look at things through my medical eyes and say, okay, here's a child who needs medical help. How am I going to do that? So I love doing these podcasts. I love doing these Facebook Lives. And again, if you're listening to this as a podcast or watching it on YouTube, we actually record these live on our Facebook page. So you can go to our Spectrum Awakening Facebook page most Thursdays at 12:15 Eastern Standard Time. I'm kind of sandwiched between New York City and Boston. You can take part in the live recording. So you can ask live questions in the comments sections and, kind of take part of it. But obviously you can listen to this anytime and, afterwards as well. So what we're going to be doing for those of you who are regular listeners, or for those of you who are not, again, what I'm doing for these first 3 months of the year, so January, February, and March for 2024, it's going to be a whole progression of kind of information of how do I help my child with autism, all right? Usually we'll pick some random topics for this and autism, and that and autism, that and autism, but I wanted to give you guys a real congruent kind of pathway or map through all this stuff. Okay. And again, my expertise is treating the medical part of autism. Obviously, things like therapies like speech therapy and OT and PT and ABA are wonderful. They're great ways to train your child, but autism is truly a medical condition. So we need to treat it that way as well. All right. So this is what we're going to kind of figure out. So where should we begin? Today's topic is going to be the genetics of autism, and we're starting at that point because I want everybody to kind of go back to when they were first concerned about their child, okay? There's a time in every parent's life when you've got a child on the spectrum that you started to be concerned, okay? And with that, you probably went to your pediatrician, or maybe you have some friends who are therapists, etc., and started to ask them, or maybe a teacher or a neighbor said, hey, you know what, I think your child might have some delays, you should probably check them out. So I want to start at that point, all right? So go back in your mind, hey, here's my young child, and when were you first concerned? When were you concerned that they weren't talking? When were you concerned that they weren't making eye contact? When were you concerned that they weren't playing or engaging with others, whether it be you, whether it be siblings, whether it be other kids? Think about that time, because that time is really, really important. And it's really important for me as an autism doctor because I love to talk about the second law of physics. All right, second law of physics, if you remember, I think it was Edison. No, not Edison. Why can't I think? Newton. All right. Newton in the second law of physics, okay, states that an object in motion stays in motion until it's affected by another force, okay? And this law of physics applies to our child's development, okay? There are different developmental milestones that a child should have this skill by this age, and this skill by this age, and this skill by this age, because that's the typical average of how human children develop, okay? We've seen this for thousands and thousands of years. Obviously, there's a bell curve, and some kids will do certain things earlier and certain things later, but these developmental milestones really help us make sure we see and answer the question, is my child developing on track, okay? So go back to that time, and when I'm working with my patients, and if you're new to Spectrum Awakening, I've got a telemedicine autism practice, so I work with people, you're on your computers, I'm on my computer, we can talk from anywhere, just like yesterday, got to talk to somebody in, where are they? Illinois, somebody in Jersey, somebody in Texas, and somebody in California. So it was all over the country, and I'll talk to people all over the world, and I love it. We're here to help you guys. So whenever I talk to my patients, I always ask this one question. And, I ask them, when were you concerned? All right. And that's really, really important because I will take our kids and divide them into two subsets. All right. Subset one is the more classical story of autism, which is a story of regression. Okay. The story of regression is my kid was developing normally and they were making eye contact and we had a few words. We had dada, we had mama, we had no, we had a few words. Then all of a sudden, usually between 12 and 18 months, gone. Okay. And all those skills that they had learned disappear. This is called a regression. Okay. So a regression is when you regress those skills that you had. All right. This is the more common story. And there are many causes for it. And we're going to be getting into those causes in next week's podcast. So stay tuned. If you got a question about that, that'll be next week's podcast. And for those of you who are just tuning in, I see a lot of you guys are joining up live here. This is our first podcast of 2024, and we're going to be creating a 3-month story. All right. It's going to be a 3 months worth of podcasts that kind of take you through everything medical that you need to know with your kid. So today we're going to be talking about, again, why did my child have autism? And the more common story is that story of regression. But the other story is the story of children who just developed slowly from day one. Okay. So if you are a parent that said, you know what, I just think something's off. I just think something's wrong. They're not making eye contact. They're not talking to me. They're just not developing as I expected them to. Okay. Regardless of what your pediatrician says, because pediatricians will dismiss. And I really hate it because it puts your child at risk for getting therapies later in life when early intervention is well known to be the most successful way to do these things. So I see pediatricians say, oh, they're boys, they'll develop later. Oh, there's more kids in the family, so they don't want to talk. There's multiple languages in the family, so they don't want to talk. I hear so much dismissal, okay? And that dismissal really infuriates me because it might be a child who could get evaluated and could get early intervention. Anyway, I'll get off that high horse for a minute. If you're one of these families, and again, a lot of people will tell me, geez, I've got older siblings and that kid didn't develop like those older siblings did. Or maybe you don't have an older sibling or other siblings. You're like, geez, I just don't know. Or the other group of kids, and listen up, if you're a family who's been doing this for a long time and you tell people, hey, I've tried everything and nothing's worked. All right. That's another red flag for me that you fit in this other subset. There's the subset of regression, and there's the subset of my child was developing slowly, or I've done everything and nothing's worked, or geez, this is just different. If you've ever heard a therapist, like an OT or speech therapist, say, you know what, I know we're treating for autism, but this is not typical. Okay, there's something different about your child within that group of autistic kids. Okay, those are the red flags that you might fit in this other subset. And this other subset are kids who have genetic problems. All right. And that's what we're going to be talking about today, the genetics of autism. So we have our DNA. Okay. And our DNA has about 20,000 different genes, right? And out of those genes, if something is not working, if something is missing, sometimes we can miss a part of our DNA. Sometimes we can have an extra part of our DNA. If something's wrong with that DNA and that wrong piece of our DNA affects our brain, then we may have autism and developmental delays from day one, rather than getting autism and regressing into it between 12 to 18 months. It can happen at any time, but again, these are the common times. So I want you to, again, go back and think about, here's my child, here was their early 18 months, 24 months, how was the development, when was I concerned, how did I get diagnosed, so we can talk about genetics. And quick shout out to Brianna. Brianna said, we've missed your lives. Thanks, Brianna. I took last week off for the December holidays. I hope you guys all had a great New Year's, a great December holiday, whatever you celebrate. I hope you had good family and good times and enjoyed it. But it's 2024, it's January, it's back to the grindstone. So again, go back and think about your child. Is my child somebody who regressed, or was my child somebody who, geez, from day one, something was off, or I tried every therapy out there and nothing's working? These are the things that are red flags for me that we should look at genetics. So we're going to get in there. All right. Now, the first thing I want to show you picture-wise, and for those of you who are regulars, you recognize my autism flower. This is a little picture I made that shows the 7 different medical things that can be wrong with autism. That is autoimmunity, okay? Brain chemistry is off. Detoxification, genetics, gut digestion, hormones, and mitochondria, all right? There are a lot of different medical parts of the body. Amanda said, where can I get a genetic test? Amanda, our website. I'm going to get into that real quick. Okay, so this is an important picture to look at and think about, because when you start to get into the biomedical treatment of your child, you got to do everything. You have to test everything and or treat everything. All right. There's a lot of people who sit there in the gut world and the diet world and the yeast and candida world and don't budge into anything else. All right. So we've got to get out of here. We got to get out of this one place of treatment and do multiple things of treatment. All right. So the first study I want to show is very recent. It's from 2023, and it talks about the autism spectrum. It says here, autism affects about 2% of children, and I'm going to step back and say the new numbers are 3%. That's 3% of children, okay? Got that? 3% of children with 4-to-1 male to female ratios, and the cause of autism involves a complex between inheritance and environmental factors influenced by epigenetics. There are over 800 genes and dozens of genetic syndromes that are associated with autism. I want you to feel that. Over 800 genes. Remember I mentioned there's 20,000 different genes out there in our body. Okay, there are at least 800 that have been identified with autism. Okay, an estimated 50%, right there, 50% of individuals with autism are diagnosed with a chromosomal deletion or duplication or mutation. Okay, so if this study says 50% of our kids with autism have a genetic issue, you should do the genetic testing, okay? And I'm gonna walk you through everything that is out there and what you should do or not do, etc., okay? So what else does this say? There's also another test which we'll talk about called pharmacogenetic testing is now possible to help guide the selection of psychotropic medications. So there's many, many different genetic tests. I'm gonna walk you through them all, but they're important because this study says 50% of kids could have a genetic cause for their delays, okay? Next, here's an older study. So I pulled this out because this study is from 1988, all right? So we're basically looking at 35 years before this study, before that first study, all right? And I wanted to do this to show you the numbers, all right? So back in 1988, they said autism is a rare disorder with a prevalence of 2 to 5 per 10,000 and a male-female ratio of 3-to-1. 2 to 5 per 10,000. You know what that is? That is 0.05%, okay? 0.05% compared to 3%. And you know what that is? That's an increase of 4,000%. There's been an increase of 4,000% of kids diagnosed with autism since this was published in the late 80s, okay? We all know why, but nobody wants to let you talk about it, okay? I just got a ban from YouTube because I started talking about this reason. When you start getting into people's wallets, then they're gonna push back. But 4,000% increase. Amanda says why? I'll get there, Amanda. I've gotta just suggest it because if I say it, I get kicked off Facebook. Amanda said I should be on the Joe Rogan show. You know what? I would love to. Can you suggest, reach out to them and suggest it? I'd love to be on Joe Rogan. All right, let's continue. All right, the next study here talks about genetic testing, exome testing, and the neurobiology. This one said that they identified 102 risk genes for autism. They're expressed early in brain development, and most risk genes have roles in regulation of gene expression or neuronal communication. So what does that mean? What this study is explaining, okay? And the first study said, hey, we've got 2% of kids and 50% of them have genetic problems, okay? So 50% of them have genetic problems causing autism. How does that happen, okay? And what this research study goes into is that this happens because the genes that affect how the brain cell develops or the brain chemistry communicates in the brain. All right, so the actual development of the brain cell could be affected by the genetics or how the brain communicates. And the brain communicates with different chemicals like serotonin and dopamine and adrenaline and GABA and glutamate. And there's all these chemicals in the brain. So when we talk about treatment, okay, because you can treat these genetic things. In fact, I should probably I'll get into that study in a little bit. But you can treat different genetic things. A lot of people, say, why would I, and I get this from my patients, why would I run genetic testing? If I find something, what am I going to do about it? Okay? And that's common thought in our society. Our society says, geez, if I have a genetic disorder, for example, let's say Down syndrome. And I say that Down syndrome is not autism. Autism is not Down syndrome. I just use that as an example that most people are aware of. So if I'm born with the genetic condition Down syndrome, that will never change. I will always have Down syndrome. That will always be my DNA, okay? 100%. However, we can do things to make your life better, okay? As an example, Down syndrome. About 95% of kids with Down syndrome have extremely slow thyroids and have comorbid thyroid conditions, okay? If we treat the thyroid medically, their life will improve. So even though they have Down syndrome, and a huge medical part of Down syndrome is slow thyroid, hypothyroidism, we can treat that medically. We cannot change your DNA. We cannot change that genetic condition, but we can make your life better, all right? That's what we're doing with these genetic conditions that get diagnosed with autism. So when it comes to the genetic expression within the brain cell, there's really no treatments for that. However, the genetic conditions that affect our brain chemistry are treatable, okay? And that's how Spectrum Awakening started. I mean, Spectrum Awakening started as natural supplements to improve brain chemistry. So we'll get there. All right, next, a few more studies here. Here's a study that says we estimate that de novo genetic events contribute to 52 to 67% of cases of autism arising from low-risk families and 30 to 39% of all cases of autism. So just sit on that. That first study said 50% of autism is genetic. This study said 30 to 40% is genetic. All right? So again, huge numbers. And I know so few parents and that get genetic testing for their kids with autism. You're not supposed to know this. Your doctor's supposed to know this. Your pediatrician is supposed to know this. And I know so few pediatricians that refer out for genetic testing. Okay? Unless you ask, it's not gonna happen. So that's just slowing this all down. That's just slowing all of this down for us to help these kids. Okay? Here's another one. This is a study from Yale. Okay? So, Yale is the contribution of de novo coding mutations to autism. Mutations contribute to about 30% of all simplex cases and 45% of all female diagnoses of autism. So first study said 50%, second study said 30 to 40%. This study says 30% for all and 45% for girls. So we're looking at almost 50% of girls that have a genetic cause for their delays that are here, found by Yale. A lot of people asking what tests should we get. I'm going to get to that. Don't worry. We won't leave you hanging. Another thing that this says is mutations in about 400 genes can contribute to the females and the males with a lower IQ. So again, we're looking at a lot of different genes, okay? We have 20,000. One of those studies said 800. This study said 400. But I want you to hold on to those numbers in your brain because certain genetic tests are very minimal and not thorough, okay? And I get a lot of families who come in, and for no fault of your own, it's just what you're told by your doctor. Your doctor says, hey, we did genetic testing, and you're fine. So you hold on to that. You're like, okay, good. My doctor said we did genetic testing, and we're fine. Live shout out to Rodney. Rodney's always on. But guess what? Maybe you didn't do all your testing. And so if you don't do it all and you just do some, if that portion's fine, you didn't look at the rest. Okay, so when I do genetic testing, we test it all. We test the full Monty, everything. I'm not going to leave anything out. All right, this is from Harvard, study from Harvard, which talks about the treatment, okay? So this study had 12% of kids have genetic causes for autism, okay, a little bit lower. What was interesting is there were no differences in cognition, language, or motor scores between the kids who had genetic conditions and those who did not. And that's another really, really important fact to understand. Some doctors will look at kids with autism and say, wow, they're really bad. We should send for genetics. And on the flip side, they'll say, wow, they're pretty high functioning. We don't need to do genetic testing. That's not real. That's not true. That's not fact, okay? Based on people from Harvard, people much smarter than me, all right? They're saying that the cognition, language, and motor scores are no different in those with genetic conditions versus those without. And everybody's diagnosed with autism subjectively, okay? Somebody comes in, looks at your kid, they don't talk, they're not looking at me, no eye contact, they're lining up cars, you have autism, okay? There's no medical test for autism, so it's a subjective diagnosis. And you can get autism through a myriad of ways. So until you do the testing, you never know. Here's another one that I appreciate from Harvard. Medical recommendations to response to the genetic testing were made for 72% of those with pathogenic results. And again, we can have medical treatments for genetic mutations. All right? Can't change your DNA, but we can make your life better. This Harvard study said 72%, and that is a huge number. All right? This is why what I want to encourage in this podcast is consider genetic testing because it can be treated. All right? Now, let's talk about last slide here, and then we'll get to the live questions. That I want to go through all the genetic tests that are out there, okay? So if you have had genetic tests, I want you to understand what you've done and what you haven't done, okay? And let me also say this. If anyone is interested in me taking a look, if you have had genetic testing, you want me to take a look at it, email it to me, okay? Go to our website, spectrumawakening.com, click there's an email contact there, send the PDF of your genetic results, I'll take a look at them, and I'll be able to tell you, hey, this is something I can help with. Let's set up a telemedicine appointment. We'll walk through everything, and I'll give you some recommendations. I'll even order some more lab tests. Or I'll be able to look at the genetic tests and say, you know what? I can't do anything, okay? I would love to. I just don't have a treatment for you. It falls into that category where there's no treatments. I don't want to waste your time, but at least you'll know, all right? So if you do have genetic testing results, you can send those over. And again, well, I'll either say, I can't help you, I wish I could, or yeah, I can, let's set up an appointment and do that, all right? Because a lot of docs, especially geneticists, won't treat something that's potentially treatable. Most geneticists out there are just diagnosticians, all right? They order the lab work, boom, done, all right. And I'm going to get to Omo's question, it's a good question. Let's talk about the different types of genetic tests, and I'm going to separate them into two categories. One category of genetic tests are genetic tests that diagnose medical conditions, okay? There's another group of genetic tests that do not diagnose conditions, but they just tell you how your body functions. It's more of genetics of your individuality, all right? I can smell asparagus in my pee and some people can't. That's genetic. Or I enjoy the taste of cilantro. My father thinks it tastes like soap. That's genetic, all right? I'm a morning person. Some people are night people. That's genetic. It's not a genetic condition. It's just our genetic individuality, all right? So there's different genetic tests out there, and unfortunately, the marketing behind them is a little sus, in my opinion. So you may be ordering something and think you're getting more than you actually are. So let's walk through them. This is actually a slide. Let me do a little promo. This is a slide from a lecture I'll be giving in Texas in 1 month, the Autism Health Summit. It's going to have Dr. Andrew Wakefield. It's going to have Del Bigtree. It's going to have experts in the autism world. That's in San Antonio, Texas, the first weekend of February 2nd and 3rd. So if you're in the area, if you want to be in the area, Autism Health Summit, check it out, okay? All right, types of genetic testing. Here are these first three, okay, are the ones that diagnose medical conditions. This is what we're talking about. All this lab research I showed you is about these three, okay? One is called Fragile X, all right? That looks for one genetic condition that can cause autism. Again, we've got 20,000 different genes. Then there's something called a CMA, which is known as a chromosomal microarray. That looks for missing pieces of DNA, okay? If you're missing a piece of DNA that's from your brain, you need that piece, okay? Then there's something called a whole exome sequence, and this looks for genes that aren't functioning correctly, all right? So what we offer on our website is the CMA and WES genetic test. So if you're interested in getting a genetic test that diagnoses a condition that can cause autism and could be treated, all right, you want the CMA and WES. So we've got it on our website. Ours is a cheek swab. It's like a Q-tip, okay? Put it in there like you're brushing your kid's teeth, get it full of saliva, put it in the mail, and it's done. No blood draws, nothing else, easy peasy, okay? Through our website, there's no insurance coverage. You could go to your doctor and talk about getting the CMA and WES test. Probably going to be a blood draw, and they may be able to get it through your insurance. All right. So what's important is getting the testing done. And we've got it on our website, easy as a cheek swab, in case you want to do it that way. Right? Next, there are genomic tests. These are the tests for genetic predisposition, genetic risk, genetic individuality. All right? These are things like MTHFR. MTHFR is a really popular gene talked about in the autism world. It does not cause autism, okay? But it's a risk factor that affects your brain chemistry and anxiety and depression and can be treated, okay? There's also a test which was on one of these other research studies called a pharmacogenetic test. A pharmacogenetic test just analyzes the risk of side effects from medications, okay? And, if you are going to put your child on, psych meds, and some families do, and then some families don't. My practice, we never prescribe those. I think natural stuff works better. But if you're going to, get a pharmacogenetic test, because this will analyze the risk for side effects. Because frankly, our kids who are nonverbal can't tell us if I'm feeling suicidal on my antidepressant. And you know what? That's one of the side effects for using Prozac or Lexapro with children is suicidal thoughts. How can they tell us those things? So if you're going to go on psych meds, get a pharmacogenetic test. And those are easy to get. Your doctor can do it. Easy peasy, lemon squeezy. But the real big ones that we're looking at are the CMA and WES. Okay. So those are the different tests. And then what do you do when you get those results? Well, when you do those tests, you want to talk to somebody who really knows about genetics, about genetic treatments. So this is a big part of my practice where we'll get these tests done and we'll look at different treatments and help our kids as much as possible. Let me give you my favorite story on genetics. My favorite story is this probably like 7-8 years ago. I was in my office and mom brought in identical twin boys, okay? And identical twin boys, they did not have the regression story. They had the story of, geez, everything was slow developing from the beginning. So we did genetics. Turns out they had a 1 in a million genetic condition that was 100% treatable. And luckily for us, the expert in the world for this genetic condition was just 20 minutes down the road. I'm 20 minutes from Yale. It's a Yale doc that specializes in these treatments. They went there, and within 2 weeks of treatment, they went from nonverbal to mainstream in their school. It was amazing change because we were able to diagnose the real medical condition. Did they have autism? Yeah, they had delays in their development, but why? Okay, why for them was this gene that wasn't working? And luckily for all of us, that was very treatable. And that treatment brought their brain to a place where they're able to recover their language and just mainstream in school. And that's the amazing thing that can happen. Now, that doesn't happen all the time. I want to be like a Weight Watchers commercial. Like, you can't lose 50 pounds in a day, but the potential is there. And that's why I really want to encourage you guys. Genetic testing is really important. When we have scientific research that says up to 50% of kids, okay, up to 50% of females can have a genetic cause for autism, okay? So get the testing done. Make sure you're getting the correct testing done, all right? MTHFR, pharmacogenetics, that's great, but it's not going to diagnose anything, all right? So you need that CMA and WES. If you want to get it done through your doc, maybe through insurance, that's great. If you don't, we've got it on our website, Spectrum Awakening, and it's a cheek swab. Swab the cheek, send it in, boom, done, okay? Since we're talking about that, let me give you the coupon for the weekend, which is applicable to, geez, my brain just stopped, to the genetic testing. So our coupon of the weekend is Genetics20. Make sure it's plural there, Genetics20. That's going to get you 20% off anything on SpectrumAwakening.com. The lab tests, like the genetics, other lab tests like oat test, stool test, any of the supplements, even the bundles. And again, if you want one-on-one help, you can always schedule a video appointment. You can do that through our website. Okay. Casey asked a quick question. How much for the test? It's a good question, Casey. Genetic tests are expensive. Okay. The good news is you only have to do it once. Okay. You do it once and it's done. Genetic testing cost depends on which lab you use. Okay. So labs here in the US, they're generally going to charge between $5,000 and $10,000 for this test. Okay, maybe your insurance will cover, maybe it won't. Maybe you have a copay or a co-insurance, but that cost is usually $5,000 to $10,000. We work with the largest genetic lab in the world, which is out of Europe, and they do this cheek swab test for about $1,500. Okay, we've worked a deal with them so you can get it. If you use our coupon, you can get the genetic testing done for under $1,000. So that's what we've got here. Why is my phone making sparkles? I don't know. Did I say something that made it make sparkles? I'm not sure. Anyway, so if you use the coupon, who was Casey? If you use the coupon, it'll be under $1,000 for that cheek swab, CMA, and WES. Okay, but again, you might be able to use your insurance with your doctor. Either way, get it done. All right, now let's get to our live questions. The other thing I would recommend before our live questions, again, if we, where do I begin? If you're new to Spectrum Awakening, if you're new to the biomedical treatment of autism, there is a beginner's guide ebook, which we just put out a couple months ago. I would download that. It's free, but it does walk you through genetics, and it walks you through a few other things that are really important in those beginning days. It also walks you through beginning supplementation. And there was a question down here, which I'll get to, which basically asked, how do we treat genetic problems that cause autism? There is no one answer for that. We have 20,000 different genes. The research says anywhere from 400 to 800 different genes could affect autism. They're all going to be treated individually. However, the most common treatment is going to be brain chemistry balancing, because those are the genes that can affect and cause autism. So I would recommend, if you want to jump out on a supplement, I would say our Power and Focus powder or capsules. This is our #1 supplement, first one that I ever formulated. Or you can get what's called our Skowron solution. Skowron solution is a combo of 4 different products, things like our anger management and folinic acid, our serotonin supplement, and our dopamine attention on the double supplement. This is a 4-pack combo that'll balance your brain chemistry. It's a little bit more individualized than just Power and Focus, but I would start there for either of them. And that should pretty much help support any genetic issues that affect brain chemistry. All right, it's not going to improve the genetic issues that affect kind of the interworkings of the brain cell. All right, those really don't have much treatment. But that's what I would do. Again, consider the test. Definitely download the free ebook, and then that's the supplement you may want to consider. And again, for those of you who are tuning in now, welcome to 2024. This is the first of a 3-month mini-series. I'll just call it a mini-series podcast. The next 3 months, I'm going to be walking you through kind of the progression of autism medically, what to do, how to help your kid kind of thing. So we're starting with kids that either A, just slow developers from the start, or B, your therapist says, you know what, your kid's different. Your kid doesn't fit the mold. In the autism world, your kid doesn't fit the mold. Or families who have been through this a lot and said, you know what, I've tried everything and nothing's worked. What's next? Okay, those are the big red flags that I listen to for my patients that you need genetic testing. All right, let's get to some more of these live questions. Colleen said, good afternoon, Happy New Year. Happy New Year, Colleen. Hope you guys had a good time. Tracy said, can the yeast mold biofilm enzymes be opened and put in juice? Yes. We have to titrate up extremely slowly with sprinkles due to MCAS medication reactions. Will microdoses be enough to impact biofilm? Yes. Is it okay to start microdosing the grapefruit seed extract or oregano oil with it now? Yes. So you can do all those things, Tracy. All right. Brianna said we've missed your lives. I'd take a week off for the holidays. Can you explain MTHFR? Yes. Also, mitochondrial dysfunction. What causes it? Does it typically get worse over age? Would a child be typically developing up to a certain point and then have symptoms? Great questions, Brianna. So, MTHFR, I'm going to be talking ad nauseum in a podcast from 2 weeks from now. So make sure you tune into that one. And I've also done MTHFR podcasts in the past. I even have an MTHFR free ebook on our website. So those are some places to check. But let me explain it briefly, and then I'll explain it more in the podcast in 2 weeks. MTHFR is a gene that affects the production of brain chemicals, things like serotonin, dopamine, adrenaline. So if the MTHFR is not functioning, you're going to have low levels of those, all right? And if I have low levels of serotonin, I'm unhappy, I'm not sleeping, and I have poor language, okay? And then there's other brain chemicals as well that are going to affect focus, so perhaps low focus. So that's what MTHFR does. So again, it can affect those things. Luckily, it's totally treatable, and we treat it with our folinic acid. So if you have not tried our folinic acid powder, that's how we treat MTHFR. We also have, for those people who don't want powder, we have little chewable tablets. So we've got the supplement Belicious for MTHFR, helps support the MTHFR function. All right, next, what is mitochondrial dysfunction? Again, that's going to be another podcast in our mini series. You can also go back and watch other mitochondrial podcasts, but mitochondria produce energy. And you know what needs energy? The brain to develop. You know what else does? Muscles, right? And I'm not just talking about running around muscles. I'm talking about the muscles inside our body, like our colon, okay? So the severe constipation that our kids get, the acid reflux that our kids get, the poor concentration and focus that our kids get, the low muscle tone that our kids get can all be from slow mitochondria, okay? What causes it? In my belief, it's toxins. Toxins and toxicity can cause it. So we have a lot of supplements that'll get your mitochondria working better, but until we get rid of the toxicity, I think that's a major cause to help the mitochondria. Does it typically get worse over age? Yeah, because the toxins are continually affecting it. Would a child typically be developing up to a certain point and then have symptoms? That's the regressive kids. So again, normal development till 12 to 18 months, bam, disappears. That's the kind of regression or the description of a regression case of autism. Versus non-regression, which is the genetics. All right, Amanda, where can I get a genetic test? Your doctor or my website. Tracy, holistic doc, who has been on a local Christian station for over 20 years, highly recommend, is helping me with my son, plantar wart. He says his spleen is not producing enough antibodies, no virus, leaky gut, adrenal issues, dual mode network. He has supplements and a rash, and he has BART, LabCorp negative for body antibody, but I can use your reminder maybe. Well, that's great, Tracy. I hope that helps. Casey, nonverbal 8-year-old girl, what can I do? Well, again, Casey, if you're new here to Spectrum Awakening, the first place to start, download our beginner's guide. Okay, so go to our website, spectrumawakening.com, click products and literature, and it should pop up. I think it also might be on our carousel as well. So download that beginner's guide, take a look at that. If you're looking for supplements for language, I would start off with our number one supplement, Power and Focus. Comes in powder, comes in capsules. I would start there. We've got a line of 75 products for kids with autism, so there's a lot of things you can do. But if you're looking to start at one place, start with the supplement, download our beginner's guide. And we are making a more advanced guide, so that's going to be coming out soon as well. Amanda, my son has gained new behaviors last year, completely different. Throat tick, more hyper. He's 16 now, just changed. Well, I would look at two things, Amanda. Number one, if this kind of gets worse after a cold or flu, it might be pandas or PANS, and you should look at that. Or other than that, I think you're dealing with some kind of gut infection. So I would either try our yeast mold bundle. We revamped our bundles for yeast mold. And I would also consider a stool test. Try those things. Amanda said I should be on Joe Rogan. Help get me on, Amanda. I'll do it. Tracy said, I love this topic. You're welcome, Tracy. Jeannie, I'm a big advocate of the super oat test on our website. I speak from personal experience. Please do the genetic test. Dare I say, stay away from the conventional hospitals if possible. Well, thank you, Jeannie. And again, we've got multiple tests on our website, including the super oat test from Genova. We also have the oat test from Great Plains. We've got stool tests. We've got mold tests. We got heavy metal tests and food sensitivity tests and genetic tests. All sorts of things to help you guys. We're here to help you guys help your kids. That's why we're here. Amanda says, my son is ASD, but I got him tested for ADHD and the symptoms are the same: lack of focus, connection, hyperactive. There's so much overlap in these things, especially when it's subjective diagnoses. You know, it's like, hey, are you paying attention? No. Well, you have ADHD. Well, can you speak? No. Well, you have autism and also lack of focus. So honestly, I think all of these diagnoses are semantical, just to get coverage for different medications. So I feel autism has a multitude of symptoms, including lack of focus. So do you call it that and ADHD? That's for the insurance companies to decide, not me. I'm here to help kids, not figure out what diagnosis they have. Kay says, Natalie's test should get to you through the patient portal. Awesome. Thanks from her grandmother in Kentucky. And after the full moon passed, she is fine again. That is awesome. We're dealing with parasites, aren't we? We're going to get rid of those parasites if it was the full moon. Tracy, I can't get over the idea that my son has this issue with contamination, OCD, and possible brain damage, even though the neurologist says there's no damage because there's no damage because of inflammation. Sad seeing our kids struggle. Thank you so much for your knowledge to help us. Tracy, you're welcome. You know what? The more I think about OCD and that massive amount of anxiety, Tracy, if you haven't done parasite work, I would get into that. I would get into parasite stuff. But you're welcome. I am here to help you guys. Yvonne, just sent in our son's swab for genetic testing through your website. Awesome. Curious about the outcome. How long does it take? 3 months. Okay, so Yvonne asked, how long does it take to get results from genetic testing? 3 months. Doesn't matter who does the testing. It's not one lab versus the other. It's just how long these things take. All right, so it's going to take a while, but remember, you do it once and you're done. Amanda, I think if I treat ADHD, my son would be a different kid, but hadn't got diagnosed yet. Of course you can. Well, yeah, go for it. Treat it. Do it. Inderpreet asks, what genetic test would you recommend? Again, the CMA and WES. Those are the tests that will diagnose genetic conditions that can cause autism. Pat says, Happy New Year. Happy New Year, Pat. Rodney, always there. Rodney, have we met at a conference yet? I hope we do sometime. You're always on our podcast. Amelia, I just found out my son has a microdeletion of 15q11.2. What can I do? I'm so lost. Well, number one, that makes me sad. It makes me sad that somebody got genetic information on their child and a genetic test done, went to a doctor, and you feel lost. Shouldn't you feel encouraged that you have information and know what to do about that information? And this is one of my beefs with conventional medicine nowadays, is that there's so little help, right? So I want to help you. So what I want you to do is get that PDF and email it to me. All right, so just go on our website, spectrumawakening.com, find the email, you upload your PDF, let me take a look at it. And I will tell you, yes, I can help you. Let's set up an appointment. Or no, I don't know anything here. I wish I did. We can go from there. All right. And I say that, I need you to upload that because different deletions are different in different kids. So even though it's a 15q11.2 deletion, certain kids will have some more or less genes missing, and that affects what that microdeletion does in the brain. So just email it to me, and that's the best way for me to give you the most accurate result or accurate response. Cynthia, I had my son tested through Genomind. Does that include genetic testing, or is it limited to pharmacogenetic? I believe it's just pharmacogenetic, Cynthia. But again, if you email it to me, I'll be able to tell you. Omo, how do you treat genetic mutations would help language? Again, I would start with our Power and Focus or Skowron solution. Amanda, what do you think if your child craves salt on everything? Good one, Amanda. Shiitake mushrooms. I need a bigger desk. Well, I'm not sure. I don't know where I put it, but if you crave salt on everything, you've got issues with your adrenal glands. Okay, so what I would recommend is our Temper Tamer supplement or our Temper Tamer 2 supplement. Okay, craving salt, adrenal issues, aldosterone issues. Just take adrenal support. Julie, I've been following you and purchasing supplements. We did genetic testing through a well-known recognized hospital in Chicago. Told us genetic testing did not detect anything. Yes, please, I want to look at genetic testing. Send a different email. No, send to the customer service at spectrumawakening.com email. That's perfect, Julie. And again, it's get a second set of eyes on it. And again, a lot of geneticists are going to ignore anything that's not a huge red flag. Like, you have Down syndrome. It's obvious. All right. Send it over, Julie. Everybody deserves a second opinion. All right. Michael, will the whole exome, the WES test confirm MTHFR? No. I want to hold up my page again, Michael. So again, these tests, these genetic tests are all independent. Okay. The Fragile X, the CMA, the WES, the MTHFR, the pharmacogenetics. There's no overlap. They're all different and independent. And the MTHFR test, 50% of the world has MTHFR that's not functioning at 100%. So it's really common, and that's not going to be a genetic condition. We can't give a genetic condition to 50% of the world, okay? So they're all different tests, Mike. Jeannie, is there a test you have for PANS or PANDAS? I don't. That's more blood work through your doc. Things like, strep antibodies and viral antibodies and inflammation markers. Or some people do the Cunningham panel, which is good, but it's not super thorough. There's another neurological autoimmune test that Quest has. So there's a lot of options. Omo, wow, I have twin boys. I really need this. You do. I think a lot of people do. Again, based on the research, half of you do. Mitesh, what do you think of stem cell therapy? Well, Mitesh, I'm going to give you an answer you don't want to know. You don't want to hear. Every autism expert that I've spoken to in the world says the same thing. And these are experts that treat patients. I'm not talking about scientists, okay? Scientists are great. We need them. I'm talking about clinicians. Every expert autism clinician in the world I've ever spoken to has said that any patient that got stem cell therapy had 2 to 3 months of improvement that disappeared after the 3 months. So I don't think stem cell therapy is the magic bullet for autism yet. Hopefully one day it is, but I've never spoken to a patient personally. I've never spoken to a clinician, an autism clinician that has a patient who has said stem cell therapy changed my life. I just haven't seen it. It's really expensive for that. All right. Chris says, what lab do you use for genetic testing? We use a lab called Centogene. Again, they're out of Germany. Huge lab. They do genetic testing in almost every country of the world. All right. What else? Chris says, do you test for lysosomal disorders? Well, that's probably a question for Centogene to ask, what's on their whole exome. I would ask that. I don't want to give you the wrong answer. Casey, my daughter was offered a genetic testing. We did everything, came back inconclusive. Well, Casey, if you want a second opinion, email it. I'll give you a second opinion. So what can we do for twitching, the body part of an autistic child? Twitching. Well, first off, there's a lot of different kinds of twitching. I would first get an EEG to make sure it's not a seizure. Amanda says, can you lift that testing up again, please? Sure, I can. Okay. Genetic testing that causes disease, Fragile X, CMA, whole exome. Genomic testing that only looks at who you are as an individual. It doesn't diagnose anything. MTHFR, other polymorphisms, other genomics, and pharmacogenetics. All right, I got a few more minutes for a few more questions. Smita, we did pharmacogenetic testing. Our doctor mentioned this test is useless, even a neurologist. Well, that's their opinion. I have a different opinion. If the pharmacogenetic test says this medication has the highest risk of side effects, why wouldn't I avoid that and try medications that have the lowest risk of side effects? A lot of docs, especially with psych meds, just prescribe. Here's what psychiatrists are taught. Okay, prescribe a med. If it doesn't work or they have side effects, prescribe another med. If it doesn't work or they have side effects, prescribe another med. If those 3 meds don't work for them or they have side effects, refer them to another doc. Okay, that's their flow chart. They don't want to do preventive testing and say, yeah, you're probably going to have a side effect with this one. Let's avoid those. They're just going to prescribe, and if it doesn't work for you, they'll give you another one. Okay, bing, 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 bing. It's about sales. It's about sales. Okay. In fact, I saw an article from a medical doctor that said that how much money she gets from insurance is graded based on how many drugs she prescribes. So she had a patient who had a cholesterol level of 205, like barely elevated cholesterol. She worked with this patient and said, we're going to change your diet and you're going to exercise instead of giving you Lipitor. Okay. Now that doctor, because she recommended diet and exercise and didn't prescribe a medication, makes less money from the insurance companies. So I bring that up because we're in a world of conventional medicine where drug sales are driving everything, including whether that pharmacogenetic test is appreciated or not. That's life. Okay. I'm sure they don't want you to know that, but that's life. All right, Armando. Oh, I hope Enzo's doing well. Happy New Year. Hope to see you soon. That would be awesome. Oma, what about Fragile X? Is that part of the bundle and the MTHFR? No, it's, again, totally separate. Corey, pretty sure he leaves sparkles wherever he goes. I think you're talking about me, Corey. So many sparkles. Oh, yeah, because of the thing. Brooke says, awesome. Maria, hey, Maria, Happy New Year. Been hearing a lot about lion's mane. What are your thoughts? Lion's mane's great. Hold on, where is it? I got lion's mane. Somewhere on this messy desk. I got it. Anyway, Maria, lion's mane is a type of mushroom, and it's great for the immune system. So We have a supplement called Immune Mushroom. I would try that. It's a great combo of multiple mushrooms like chaga and lion's mane and some great other ones that really help the immune system. So I would try it, see how it works. Deb says, wish we could get rid of the autism label. It has become so muddled and adversarial. Let's just call it something like individualized health plan. Yeah, it's a mess for sure. All right. A couple more questions and we're going to wrap up. Reem says, what helps vocal stimming? Again, I would go back to our either the Power and Focus supplement, that's our number one for language, or the Skowron solution, which is a bundle of 4 different supplements that you can alter. Happy New Year, Denise Zaneta. Sounds like my son. High IQ, but language isn't progressing. Lindsay, is there a supplement to help with visual eye stimming? Yeah, I would do mitochondrial support. Our eyes have 6 muscles each. That's 12 muscles that best to be working together. So if you're doing that eye stimming, I would try mitochondria. You can get vitamin A as well. Casey said genetic testing was inconclusive. Send me a copy. Brianna, thank you, Dr. Skowron. As always, you explain things in a way that worried parents can understand and appreciate. You're welcome, Brianna. That is one thing I can do well. Don't ask me to put the toilet seat down or change the oil in my car, but at least I can do this. Christopher, what age is too old for you to help? There is no limit. There is no limit to hope. There is no limit to trying to help your child. There is no limit to giving up. Okay, and I'm going to wrap up the podcast right here because I think this is an important note, Chris. There is no age to stop trying to help your child, period. Okay, I've had kids from birth to probably 40. Okay, and it's never too late to try to do something to help your kid, and that's the message that I need you guys to spread. I'll be here every week. I'll help you guys help your kids. You need to spread the word. Okay, there's families all over the world who don't know that there's help. They go to their therapies, they go to their docs, and they're like, "Yeah, this is it. Sorry." When there's so much more, you guys need to spread that word. Okay, so let's summarize and wrap up here. We'll get the coupon again. This is part 1. It's 2024. This is part 1 of a 3-month mini series podcast walking you through the medical issues of autism. The first one is, why did my kid get autism? Okay, you either have a kid who regressed around 12 to 18 months. We're going to talk about that next week. Or you had a child that was a slow developer from the beginning. Those are kids that more likely have a genetic cause for autism. They were born with a gene that wasn't working that affects their brain development. Okay, so what I want you guys to do, and again, the research shows up to 50% of kids with autism can have a genetic cause. Get tested. Get tested. That's it. Get tested. Why? Because based on the study from Harvard, 70% of those with genetic causes for autism can get a treatment. Okay? That treatment may totally change your life. That treatment may make you 25% better. We don't know. We don't know until you get it done. So if you have not had it done, what you want are these tests, CMA and WES. You can ask your doctor. Okay? They'll probably do a blood draw. Insurance might cover it, might not. We have one on our website if you want. It's a cheek swab. It's a big Q-tip. Put it in your mouth like you're brushing your kid's teeth. Get it covered in saliva. Mail it off. Okay, no insurance coverage, but it's the most affordable genetic testing on the market. We do so much genetic testing with the biggest lab in the world. They cut us a deal so you can use our coupon and get this done for under $1,000. Okay, if you already have genetic testing and you want a second opinion on it, upload the PDF and email it to me at customerservice@spectrumawakening.com. I'll take a look at it. I'll say, yeah, I can help you. Let's set up an appointment. Or no, you know what? I can't help you, but at least you know that it's here. All right? If you want to use the coupon this weekend on Spectrum Awakening, use Genetics20. Make sure it's plural. Okay? Genetics20 going to get you 20% off any of the labs, genetic labs, stool labs, oat tests, whatever. Any of the supplements, even the bundles. That expires January 7th, 2024. And if you want a one-on-one telemedicine appointment with me, go to our website, click appointments. You can set it up right there on our website. Okay. Thank you guys for doing everything. Thanks for tuning into this podcast. There were a lot of you today. I love it. Hope you guys all had a good New Year's and a good holidays. And thank you for doing everything you can do to help your kids. And we'll talk to you next week. Thanks, everybody.